Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Selamat pagi, Prof. Azarina. Can you hear well, yeah?
Boleh, Prof.
Okay. Thank you very much, hardworking anesthesiologist, our NS Prof. Azarina, for the kind introduction. And again, congratulate Prof. Zarina and the gang to have the webinar for PPD, Personal Professional Development. And I was given a task to discuss about effective career advancement. And I apologize to change the schedule. Supposed to be the first one delivered by our emeritus, Dr. Wan Zurina. I have a meeting about 9:30 or so. So I'm going to be very fast, and I gave a lecture a couple of days ago about the research as a continuation. How you're going to see yourself in 4 years' time, in 7 years' time, in 10 years' time. What are your position? What are your thinking? You have to start from now rather than later. Now, if I look back where I was trained, there's similarity in terms of map between Republic of Ireland, which is, yeah, you know where is it, and then the Peninsular Malaysia in terms of geographical location. If I look back my place where I was trained at your stage, a lot of clinical science, and I enjoy very much clinical research facilities from the main hospital, about 1,200 bed, go there every day really, and every week listen to the multidisciplinary talk attended by not only clinicians, surgeon, physician, but also scientists, neuroscientists, clinical biochemists, physiologists, and sociologists, mathematicians. All of them we gather together to discuss weekly what are the issues that we can solve in the community. So if I ask yourself and myself and my colleagues, what is the half-life of career in clinical medicine? I can tell you by the end of your career, most of what we have learned, it become nonsense and absolute. Believe or not, with the rapid kind of emerging technique and modalities and pharmacotherapeutic that we use. So if I want to phenotyping all of you, you can be painful, enthusiastic, you can be overly academic, you can be the one who missing in action, cannot on-call, who's going to do the on-call. You could be childish, you could be sin one, you could be one-track mind. So these are well described in the cartoon, so you can choose which one is yours. We all underwent medical curriculum. We all know that from the year 1 to year 5, we have a lot of very important basic science. If you do have this important, this is the time for you. And the rest of the 2 or 3 years or so, we involve mostly a lot of clinical practice, and some have a special study module. So embedment or having the strong knowledge of the basic science is very important in your clinical practice. So the postgraduate has changed a time when you do undergrad, the stepwise traditional approach. Now the postgraduate, not only time, but also expertise. You all want to be physician, clinician, whatever your interest is. And of course, there are many things that you have to gather by 4 years' time, hopefully a doctor of internal medicine and surgery, pediatric surgery and editing, and hopefully you got specialists and you become a consultant in the future. Now, this is summary of your life cycle. I can tell you, and I'm sure my colleagues, Prof. Zarina, Prof. Dr. Zo, Prof. Dr. Wan, everyone who attended agree. So you have done your primary school, your secondary school here. You have attended your medical school, you get the degree, and you have done a houseman or nationally inside the country or outside. You have done a social senior house officer or medical officer. You can be a chronic medical officer syndrome in clinic kesihatan. You can be chronic medical officer in university. Now your journey is here to get Master of Medicine or Internal Medicine. So you're not halfway yet, you are getting there. So congratulations to all of you. So these are the things that you need to chase. And then when you graduate, I hope that not only be internal physician, because hundreds of thousands gender specialists, Malaysia needs subspecialists. So I hope you do a fellowship again, you do subspecialization. To those who overseas, you can come back home. You can do this in overseas, or you're fed up in public practice. You have an option, have a private practice. If you love money, money is everything, but money is not everything. Everything needs money. You can continue your progression, but watch this space. When you do a fellowship, you may want to do something else to fine tune, to uplift reignite. You may have to do PhD or MD or Master of Science or MBA. You continue to progress. You hold the top post, either public and private, and you're giving back your expertise to society. So I can tell you in this slide, these are your life cycle, whether you like it or not. Yes, in life, we can plan, but also we have to have a plan B, plan C, plan D as well. But in the COVID era, things become dynamic, become complex. Where are you working in the office or are you working at home? Is it 9 to 5? Is it 5 to 9? How you fix your time? These are becoming very difficult to control, and very important to have yourself have a control what you're going to do. I'm not going to elaborate further on this. So what are the problems usually what I see facing among postgraduates globally, not only in Malaysia, but also abroad, in terms of developing urgency and importance in making decisions? Interpersonal skills, maybe lack of mentoring, motivation, decision-making, networking, public speaking. You know, to be a doctor's clinician scientist is very important because you're going to communicate with your patient or relative that harass you, for example, or asking so many questions, and you need to know this. I think there's communication and health advocacy in this last thought of the day. So very, very important. So if you fail to plan your next 4 years or so or more, indeed, you plan to fail. So have you made a correct decision to come here to pursue higher clinical training? Of course, I think you have. And again, congratulations to all of you. You can see the noble how to be a clinician. You relieve the suffering of others. When you leave the house with good intention to helping another human being, provided you are sincere, does not expect any reward from the patient. You don't need to put in your Facebook, social media, I do this, I do that. No, I think God knows what you're doing. Confucius, tell me and I forget, teach me, I will learn, and involve me if I will remember. Can you be a specialist one day? I think you can, definitely, but there are a lot of things that you have to do. And you have to be strong determination, focus in your study goal, strong discipline, healthy attitude in your studies, not only in clinical, but also research and non-other clinical work. And you have to be strong and enjoy your study. You have to have a critical thinking. You have to be like private investigators. A lot of patients coming here, not like typical in clinical kesihatan that you're facing before with a different complex symptomatology, and use adequate knowledge of basic science that you learn. No harm. Sometimes I do love reading regularly or a couple of times per year, ABC of physiology, ABC of pharmacology, ABC of biochemistry, all these 20 essential amino acids. I think is very important in day-to-day practice. So you have to be a critical, systematic thinkers, relevant question, have a sense of curiosity, interested in finding, listen carefully to others, and brave to have the feedback, examine problem closely and have a belief in that. So if I look at the chest X-ray here, you have to be very systematic. You have to comment from A, B, C, D. A is airways, the black. B is the bone is okay, clavicle, anterior, posterior rib. C, the cardiac size and the cardiomegaly, for example. D, right diaphragm is always higher than the left diaphragm because the liver here, the gastric vessel here. E, etc., tumor or malignancy or pneumonia. So you have to think very systematically and also in life. So a person who does not work hard in their younger life will never have a relaxed life when they are older. You can ask Prof. Datuk Wan Zurina after this if you don't trust me. And everything in life has to be earned, and all of us has to pay the tax, whatever our achievement is. And to be a clinical specialist in the future, now you have to pay tax. What are your tax? In the form of study at night, on call, working hard. You have, I think, best to have a study group, do a great research for your future selling point, time management, and many things. These are your tax that you are paying now. So in terms of time management, these are well documented 7 divisions of time, how you have time for family, society, your health, finance, keep 10% of your income, don't straight away, drive expensive car, don't try to save money on academic material, buy books, read that regularly, spirituality, study and self-development, all these things. These are the time that you're going to invest. And guideline to control, I'm not going to be, you are matured doctors, monitor your time. Time is a fixed income, plan everything that you want to do. Once invested, you never get it back. So you reflect how you spend your time, and do your some time or dead time or meal time that you have chat and listen to beneficial program and write the abstract or whatever your journal you're interested in. So there are many self-imposed time waste, all this Facebook and Insta Twitter syndrome. Prolonged use of this, you have to be extremely careful in this, Have a short, medium, long-term plan. This is an example many years ago. I think how many years ago? More than a decade ago. I have my intern. I said, tell me, blah, blah, blah. On the second day, my name is Andrew. I want to finish my medical degree. He was undergraduate, doing kind of SSM with me. Flying colors, hoping to do internship with me, aim to have a postgraduate training, 5 to 7 years. I probably go abroad, either these 3 countries, to do such special training, probably read the medicine, and then I come back to Ireland to serve to my country, and also I do some of this. So, we discuss what are your career plan, take the boxes like today, like you're going to face. And believe it or not, this is Andrew, and nowadays, a couple of weeks ago, he's appointed as a professor, as a nephrologist in my alma mater, and continue to do this. And, we still engage, and I got a lot of mentees all over the world. And it's great pleasure to see how their success, how we discussed more than a decade ago or more than 15 years ago, materialized to this level. And I also have a mentor, for example, last weekend when we have a virtual gut in KLCC, this is one of the mentors in Mayo Clinic College Medicine. I would love this, how asking how you're doing and so and so. So the professional relationship can last forever. So how you start this month, I'm not going to teach you. I think you all are brightest brain coming to here, or output learning, study group is very important, especially dealing with clinical issues. And don't try to isolate yourself, try to create a study group among yourself in whatever specialty you do. And I think it's very important to have a study group, important for postgraduate, a way that you consistently, regularly check within each others. Don't try to be a jealousy, don't try to be selfish. Teach you how to be tolerant, interactive, acquire interpersonal skill, share cases together. If you are in the medical 6, medical 4, you see a beautiful Bell palsy or stroke or Guillain-Barré syndrome, you can share with your friends and the vice versa. So in other words, so that you maximize optimizing and a well-organized. And again, study group is not a substitution for your own study, and supplement enhance your own study as well. So how to keep your interest in clinical medicine? So you look around the seniors who has passed the exam, how they progress. You can look at, we have the Director General of Health becoming a very successful now, not only the surgeon, but also very eloquent, talking about the public health medicine, which is, he never been trained in public health medicine, so you can imagine. So avoid of friends having negative attitudes, visualize your future, see at the end of the tunnel what you're going to do, and watch also the new species coming all over the world, which is really still with us, in clinician scientists, physicians and engineers, all sort of interventionists, and many other rare subspecialty training program. But as a clinician, to be honest, good history and examination give you 80% of diagnosis. So don't copy and paste the notes from the emergency department staff. Do a thorough history, because 80% you can diagnose all the disease. We only rely 20% of MRI, CT scan. You have to get a good clinical acumen in your days. So how do you present your case? You never get a second chance to make a good impression. How things are said are more important than what things are said. I think we have the communication. I'm not going to the detail, but 75% of communication received are incorrectly received. So you have to be extremely kind of communicative, public speaking. You have to present to your colleagues, your team during the work round. You have to be very confident in what you're talking about. And of course, any platform analysis, these are the medium that you have to consider. Those who are day-to-day that you're going to meet, and you have to have a very good manners with them. And of course, I think they're going to go detail about verbal and non-verbal type of communication. And we all know that when we communicate, more than half about body language, only 36% of voice, and 8% is what you say, words. Actions speak louder. How your body language, your seriousness, your eloquence, your tonation, eye contact, this is very important. And I think in my experience, examining the postgraduate student, sometimes your eyes look down. I don't know who you're talking to, but I think you have to have a very good skill in this. So in order for you to advance your career, if you do history, and you have to be very good, display greatest courtesy, excellent first impression, good rapport, and eventually many things that you can do in practice with all your colleagues, things like that. And how to pass clinical exam, I think I'm not going to teach you, but you have to be studies hard and smart. Medicine, surgery, any specialty have a huge subject. So patients are your best teacher. Get a rapport to them, and time yourself. Sometimes you can with the smartphone, you can deliver the history and listen to yourself how many in your presenting the history, and perform a regular basic examination from the day one, and ask yourself, your colleagues to watch and critique. Be happy to listen to the constructive or negative feedback from your colleagues, and work out for long short cases. Common thing happens commonly. Sharing and caring concept, see plenty of cases and read and examine and read again. Seeing is believing. The moment you see the cases, I still remember when I was a student, what are the first cases you see in the ward? And attend the medical conference, CPC, try to attend that, and try to have a differential diagnosis when somebody presented the CPC, and practice. Teaching during the round, very important. Don't just be my boss, big boss in the past used to say, don't be a tourist like in the ward, go to the ward. Analyze carefully each patient. What are the elements that you want to do? If you want to ask your HO to repeat full blood count, what's the reason? To repeat renal profile, what's the reason? This costs the money, save the money, and what the reason for that? So you have to think about all these things. And you want to watch many procedures, go to any places you want, in the radiology, in the ICU, anticipate proactively. Don't just carry the notes and listen and play the phone and notes going on. Why this patient, let's say, have hyponatremia? Is it medication induced? Is it hydration problems? Is it, SIADH? Or is it what? Think about that. And then you all have a smartphone. Everything you forgot, just go back straight to whatever that you have. So the types of you, I can predict whether you are the one who would wait to happen, you're wondering what happened to you, or you want something happen to you. So you ask yourself. And these are the Venn diagram for all of us, even those who are specialty consultant. You still got exam, you get study, you get KPI in terms of exam, you get family, friends, teacher. Of course, you're holidaying, enjoying, but now you cannot travel. How you work for the communities, your research project. I suggest you start early, have a Gantt chart, good supervisors. After the first part of your exam, think about research project, whether you have a business online, whether you have share something. This is part and parcel in our life. So again, tips and tricks, dedication, hardworking, good strategies, and in other words, there's so many things that you have to do. Keep reading your book, engage heavily in research, challenge your supervisors. Don't just replicate what other people has done in the studies. Challenge them, suggest to them what you're going to do, because as I said to you early on, it may be your selling point for your career in the future. You may be the one who develop a good practice guideline for measuring something in the sick patient in ICU, for example. So I think something that you can think about. And how do you do that? You have to read. Don't stop reading. Once you're committed to be a doctor specialist, reading is becoming your normal physiological process. Choose at least once a week, one paper, at least what your interest is, to develop up to date in the issues. So if I look back if I stop from the life cycle here, if you're going to do some extra high-end studies or research, in other words, I get from Dr. Asma, the President of Academic Science of Malaysia. These are the way that we're going to move forward for the next many years. Digital health, precision medicine, and clinical trial. So in this area, probably you may need to ask or challenge your supervisor. I think you are familiar, National Health Mobility Survey. We got a lot of issue in obesity, how you can be part of the game changer or part to change or to solve the problems for our countries. So, you can do a PhD after that. What's the problems? I mean, yes, it takes another 3 years. So You can see, you can get something that no one else get it. When you do that, as a scientist, do the basic science, because a lot of future clinical academic workforce, this as a preparation for biomedical scientific discovery to ensure high quality research and medical research be undertaken. And the gap between invention and the real world is still there. You do something in the lab, you do something epidemiology. When I'm talking about research, not exclusively for the lab base, it could be epidemiology, something that you want to discover. You can look at the dengue. Dengue is still killing people. This is a public health issues, something that you can do. So what kind of invention you want to do? So these are the value of death in terms of you do the research between preclinical and you translate into clinical, and what are the efficacy, for example, pharmacological, to benefit all these patients. You can argue now a vaccine COVID-19, for example, are they going to give efficacy to 15 million of Malaysians, for example, you know? So the need for our country, this species is really, we need that, you know. So I do hope, I'm not hoping all of you, I'd be very happy 5% of you to think about this in the future, because we see a lot of clinical problems that need a lot of science to resolve this. And I can tell you, it's a very rewarding. It's a pain in the beginning, but it's rewarding because the world need this. And you can see in the West, and in Japan, in Far East, many, but in our part of the region, Southeast Asia, still lacking the species called clinician scientists. So the benefits are many. You know, we can answer the research questions, gain access to many settings. We are being trusted by patient participant, and we got a lot of motivation to disseminate all these findings for the commitment of further research. And I mean, what it takes to be one, of course, your career expectation, cost, the program land, the level of competition is very high, and infrastructure to support your research. And don't forget, our hospitals, a teaching hospital is a giant laboratory. We got patient data, we got staff, we got database. This is a free of charge for you to dig down, and this can turn to PhD indeed if you play this game right. Fresh samples, if you are looking at a fresh sample in the OT samples, you know, whatever sample that you're dealing, and even primary health care also, you can do some visit or house and see the knowledge, attitude, practice, and what are the barriers, you know, among this patient. So I think beyond this, 2020, you will be a super specialist in 10 years time. You have to think hard, you have to subtype yourself, you have to give some prognosis to yourself. You have to have a strategic plan in order to advance your career effectively, efficiently in the future. If not, then you become one of the generalists, specialists, which is 1,000 in the market. Your stock exchange to go to private practice also not high. So you end up being one of the ordinary. Be extraordinary. You know, at this moment of time, everybody wants to be good in your life, in your career. And after that, become great. However, great is no longer good enough. And this is the era that we are facing. And these are 4 types of intelligence to add on further how you want to be effective in your career. We all know you are very high IQ, which is measure your comprehension to solve the problems, retain information, but also emotional question, how to measure your ability to maintain coolness, peace, responsible, humble. You know, people shouting at you when you're exchanging the patient, there's no point to shout back. In fact, you can smile and relax. If you shout back, you are no different with him or her. Social cohesion, measure your ability how to build a network of friends and maintain long over period of time. And also another one, adversity question, how you measure your ability if you get a rough patch of life and how you come out that without losing your mind. We all have up and down in life, there's no doubt from we are small until now, but how you measure, how you go through with that, something that you need to think about. So your EQ really represent your character, your SQ represent your charisma. So EQ and SQ make one cope and manage better, and AQ determine who will give up in the face of this journey. So if your adversity question is low, you will decide to quit after a year or 2 during this journey of clinical training. So you really have to have this kind of 4 type of intelligence together. And there are many books, you can read this book, IQ. There are many things in the media or in the books, reading material. And people who have high emotional and social question tend to do better in life. So those with high IQ but low this can be their servant. So a person of high IQ can end up being employed by a person with high EQ and SQ, even though the person who get high EQ and SQ had an average IQ, something that for us to ponder. Keep reading, have a roadmap for your life. What are the habits you have? What are the ciri-ciri untuk succeeding as hospital doctors? Is everything there? And I hope this declaration, I would like you to read yourself today, that I will promise to myself to study very hard, to be a successful postgraduate student and specialist in the future. I hope you can remember this, and I hope to see you in 4 years' time. You all graduate on time. So dear all, ladies and gentlemen, coming together is a beginning, keeping together is a progress, working together with all of us here will be a success. So now we embark on cleverness-based medicine. The good doctor treat the disease, the great doctor treat the patient who has the disease, the excellent doctor treats beyond horizon. So in summary, Prof. Azarina, what I can say in order to advance, work hard and smart, choose your career early, engage in research early, perform a cutting-edge research and work with others, scientists, engineers, so and so. Plan your life, have a backup plan. Don't forget interpersonal skill and all this EQ, IQ, SQ I mentioned to you. And more importantly, enjoy the journey and the success. What it looks like this is not as straightforward. Then above all, these are the very important slide of career progression, effective in life. We want to achieve so much. After many years, got MBBS or MD for 5 years or so, you become houseman. Now you become the registrar, medical officer. You're going to get all this qualification. You're going to specialize, that you're going to be consultant. But there's also another mirror that you have to remember before we were born, and we are living in the world. We are living another aspect in the world. We are going to enter a new world, and hopefully all of us go to Jannah. If you follow the hereafter, the world will follow you. But if you follow the world, the after will leave you. So very important insight for all of us. With that, I thank you so much for your attention. I hope 9:30 now, Prof. Azarina, I'm on time. And thank you so much for listening early in the morning. Thank you.